Everyone, welcome back to my YouTube channel, and today we're going to talk about the popliteal fossa. Anatomy of the popliteal fossa. So first of all, we will talk about what is the skeletopy of the popliteal fossa. So popliteal fossa is localized behind the knee joint. So we will draw the posterior aspect of the knee joint like this. This tibia, femur, tibia, and the fibula. Here, in the posterior aspect of the femur, we have an anatomical surface which is called as popliteal surface. Okay, so here that on the popliteal surface only, the popliteal fossa is localizing. Here it's like if we just draw from the imaginary lines, it will be like this. Okay, so popliteal fossa will be like this on the posterior aspect of the knee joint. The popliteal fossa is in diamond shape and also rhomboid shape, and also it is surrounded by several muscles. So now we will talk about those muscles. As I told before, the popliteal fossa is a diamond shaped fossa, so we can draw like this. We will now see what are the surrounding muscles of the popliteal fossa. This is semi-membranous muscle. Okay. Here this is biceps femoris muscle. Biceps femoris. Here there will be two heads of the gastrocnemius muscle. Same muscle, two heads. Okay. And then here there will be another muscle which is called as plantaris muscle. And also there will be another tendon of the semitendinous muscle and the tendon. Okay, semitendinous muscle. From this side we can see little bit the end part of the sartorius muscle. Okay, so here this is biceps femoris, okay, and then here this is plantaris, this is the lateral head of the gastrocnemius muscle. Okay, lateral head of the gastrocnemius muscle. Okay, and then here this is the tendon of semitendinous muscle. Okay, this is semi-membranous muscle. Okay, and then here this is the medial head of the gastrocnemius muscle. Okay, and then this is sartorius, but it's not in the borderlines. Okay, so here this is the lateral aspect, right? This is superior, and then here inferior, and the medial will be another side. So according to that, we can name the borders of the popliteal fossa. Superior lateral border is biceps femoris muscle. Inferior lateral border is the plantaris muscle and the lateral head of the gastrocnemius muscle. And then the inferior medial border is the medial head of the gastrocnemius muscle. Then which will be the superior medial wall. The border is the semimembranous muscle and the semitendinous muscle. Okay, otherwise we can tell the tendon of the semitendinous muscle. Okay, so these are the borderlines of the popliteal fossa. So here in between these muscles, the popliteal fossa is forming, and the nerves, arteries and veins are going through this fossa. Okay, so then we will see what is the syncope of the popliteal fossa. First of all, we will see what are the veins, what are the nerves, what are the arteries which are going through this popliteal fossa. Mainly popliteal artery, popliteal vein and the tibial nerve will go through this popliteal fossa. Now we will see what are the origins, how these veins, how this nerve, like how these are coming to this popliteal fossa. Hope you can remember the inguinal ligament. If we imagine this is the inguinal ligament, this we will draw the femoral triangle, right? So here there will be lacuna musculorum and lacuna vasorum, right? Here from the apex of the femoral triangle to origin the adductor canal, right? So if we draw the thigh like this, right, this will be the knee joint. Here the anatomical portion will be like this, right? This adductor canal will open from the adductor hiatus to the posterior side of the thigh, okay, not in the anterior side. So it's open into the popliteal fossa. First of all, we will see what are the veins and arteries which are going from here. This will be the femoral artery, and here this will be the femoral vein. Here this will be the femoral nerve. This artery will come like this, and this will cross to this side, to the medial side, and the vein will come like this, and it will go this side, right? Those are crossing. And then here the nerve, the femoral nerve will go just direct. It's not going to the posterior side. So this artery and the vein will go through this adductor canal, right? It will go through this adductor canal, and if we draw the posterior aspect, just as basic, here there will be a hiatus called, which is making from the adductor magnus muscle. There's a hiatus. Here there will be the popliteal fossa. Okay, this will be the thigh, this will be the leg, and this will be the popliteal fossa behind the knee joint. So here from the adductor hiatus, the opening of the adductor canal, the popliteal artery and the popliteal vein will become. Here we call the same artery and the vein only. Here we call it as femoral artery and the vein. Here when it comes to popliteal fossa, then we call it as popliteal artery and the popliteal vein. So here it will come like this, and it will go the lateral side. Here this vein will come like this, and this will go the medial side. So this is the way how this is also coming from the hiatus only, how the popliteal artery and popliteal vein is coming to the popliteal fossa. Then now we will see what is the nerve. I told that it is tibial nerve. How it is coming to the popliteal fossa, right? It will be like this. Now we will see the buttock region. How the origin of the tibial nerve. Here this is the sacrum. We will just imagine the gluteus maximus muscle has removed. So now this is the gluteus medius muscle. Okay. So this will be the femur. Right. So here gluteus medius muscle, and next to gluteus medius muscle there will be piriformis muscle. Okay. And then here we can draw the pubis bone also. Okay. Pubic bone. Okay. Then here is scale bone and the pubis both. Then here we can draw next to the piriformis there will be the superior gemellus muscle. Okay, superior gemellus. After that there will be internal obturator muscle. Internal obturator muscle. Then there will be the inferior gemellus muscle. Okay, inferior gemellus. Then again there will be external obturator muscle, and finally there will be quadratus femoris muscle. Okay, I just basically drew these things. And then here sciatic nerve, the human body's the largest nerve is the sciatic nerve. Here the muscle what now we want is the piriformis muscle. Here this is piriformis muscle. Okay, this is gluteus medius muscle. Okay, here this is superior gemellus muscle. This is internal obturator muscle. Okay, this is inferior gemellus muscle. Okay, and here external obturator muscle, and then here the yellow color one is quadratus femoris. Muscle. Okay, so here below the piriformis muscle we call infrapiriformis foramen. Okay, and then in the internal side, you know, from the ischial spine that we are dividing because there are some ligaments are going from the ischial spine to the sacrum and all, then it's dividing that space to the greater sciatic foramen and the lesser sciatic foramen, right? Hope you can remember. It will be like this. If the sacrum is like this, I'm just drawing. If the ischial spine is like this, there will be two foramen, greater sciatic and lesser sciatic. So here if we see through out this, there will be the greater sciatic foramen here and lesser sciatic foramen will be here. Greater sciatic foramen here, lesser sciatic foramen here. So from the greater sciatic foramen, when the piriformis muscle is going through this, we are dividing the greater sciatic foramens suprapiriformis and the infrapiriformis. So sciatic muscle is coming below the piriformis muscle throughout the greater sciatic foramen. So here the nerve it's coming like this and dividing into two branches. Okay, sciatic nerve. This black color thing is the sciatic nerve. Okay, So this is how, so this sciatic nerve is dividing into tibial nerve and the common peroneal nerve, which is called the fibular nerve also. Okay, so this tibial nerve is the one which is in the popliteal fossa. So now we will see all together the syncope. Okay, so here the artery will come like this. Okay, then vein will come like this, and here okay, this is the, actually this should be from the middle of the popliteal fossa, the dividing places. Okay, so here this will the artery will be in the deep, next vein, and superficially the nerve will be there. So the according to the depth, artery, vein, nerve, always it will be like that according to the depth. Okay, from that means to anterior to posterior, or to superficial to deep. Superficial to deep, it will be nerve, vein, artery. Okay, more superficial thing is nerve. Most deep thing is artery. In between that, vein is present. Okay, so in beginning, artery is in the medial side, vein next, and the nerve is there. In the middle of the popliteal, it should be middle. Okay, the dividing place, the crossing place should be in the middle. So in the middle of the popliteal fossa, the artery is going to lateral side, right? I have driven somewhat below. Okay, I will draw again. Okay. Here it is. So here, this is the middle of the surface. Here this will be AVN, and in the middle it will be, nerve has come to this side now. So it is N. So it is NVA. Okay, NVA, and in the at last also it is NVA. Okay, now vein and artery. Artery now it has gone to the lateral side. It has crossed the vein and has gone to the lateral side. So this is sciatic nerve. Okay, and this is common peroneal nerve. This is tibial nerve, and these are the popliteal artery and the vein. Okay, it's like this, and now we will see with the muscles how it's going to be there, and also with the branches and all of the veins and the arteries and the nerves. Okay, so this will be like this here, this will be like this here, and here this will be like this here. This common peroneal nerve is going along the biceps femoris muscle. Okay, this common peroneal nerve. Hope you can understand if I keep this also here. This common peroneal nerve, and here this is the common peroneal nerve. Okay, and here from the common peroneal nerve, getting a branch. Okay, I think it's better to draw here. So getting a branch called lateral cutaneous sural nerve. Here from the tibial nerve we are getting a branch called medial cutaneous sural nerve. All both together making a sural nerve, which we call as sural nerve. And here the short saphenous vein is draining into the popliteal vein. Short saphenous vein. And here there will be branches for this side also. Okay, and then here this side also, and this side also. Those are the superior. Now will be superficial. Superior lateral genicular artery and vein, and the superior medial genicular artery and the vein. Those are supplying to the knee joint and also draining the knee joint. Okay, so this is how it is. I will draw here also, then you can understand. And also there is one small branch to the soleus muscle, which is going from the tibial nerve. It's going like this. Hope you can see it. I will change the color. Here it's like this, the branch of the soleus, the nerve supplying to the soleus muscle. Okay, and then here there will be lateral cutaneous sural nerve. Here there will be medial cutaneous sural nerve, and it will make the sural nerve. This is the sural nerve. Okay, and as I told before, the short saphenous vein will drain into the popliteal vein. Okay, if you want the names of the commons, here this is the lateral cutaneous sural nerve. This is the medial cutaneous sural nerve. This is the sural nerve. Both together making the sural nerve. And here this is the short saphenous vein. Okay, here there will be NVA, NVA. Okay, and to the depth it will be the superficial will be the nerve, and the middle will be the vein, and deep will be the artery. If someone asks what is anterior to posterior means, then you have to say the anterior most one is the artery, then vein, then posterior one is the nerve, because this is the posterior aspect of the knee joint. That's all about the popliteal fossa. Thank you so much for watching.